In this video, I'm going to talk about different massage techniques. I will start this video by talking about effleurage. The technician will do a stroking motion, beginning distally and moving proximally towards the heart, with his hands flat and fingers together. Next, I will talk about petrissage. The technician will work to use his two hands to lift and knead the tissue, working to improve tissue mobility, to relax the muscle, and promote circulation. Next, I will talk about tapotement. The technician will use a cupped hand to slightly tap on the surface of the tissue in a rhythmic manner. This helps to remove fluid or mucus blockage or stimulate afferent nerves. Next, I will talk about the friction technique. The technician should use finger pads or the elbow to move in small areas of the tissue. This will help break adhesions or soften scar tissue. Next, I will talk about trigger points. The patient should use his or her fingers or ball, such as a lacrosse ball, tennis ball, or golf ball. They would then want to find the trigger point and add pressure to the point. Once they feel a slight release of the pressure and tension at that trigger point, they would then move to a spot nearby that would still be giving them difficulties. Next, I will talk about ischemic compression. The patient or technician would try to find a trigger that is bothering them. They would then pinch the trigger between their fingers, being sure to lift the entire trigger point up. Then they would add pressure to the point where they're not having pain, but it's tolerated pressure. And then they would hold that until the tension dissipates, then add more pressure until the pain disappears. Next, I will talk about vibration. Using the palm of your hand, you would then find one specific spot and stay in that spot while shaking your hand, causing a vibration throughout the tissue near that one location. Next, I will talk about active assisted techniques. Next, I will talk about the neuromuscular techniques. I will now talk about the myofascial release techniques. First, I will talk about the J-stroke technique. Using the pad of your fingers, apply a downward pressure to move the skin and tissue using a J-stroke pattern in a small area at a time. Next, I will talk about oscillation. The technician should use their fingers in a cupped position to roll back and forth over the muscle. Next, I will describe the ringing technique. Using both hands over the targeted tissue area, move your hands in opposite directions of each other, applying a deep tissue force. I will next talk about the stripping technique. The technician should use one hand to anchor the tissue down, while using the other hand, elbow, or forearm to apply a downward and forward force to stretch the tissue out below the skin. Next, I will explain the arm or leg pull. The technician should grasp either the wrist or the ankle and uses their body weight to lean away from the patient, adding traction to the limb.